Today I'm going to talk about Wilson's disease. Another perhaps fancier name for this condition is hepatolenticular degeneration. Hepato refers to the liver, lenticular to a nucleus within the basal ganglia. The two main organs affected are the liver and the brain. Like hemochromatosis, it is an autosomal recessive disorder. However, whereas in hemochromatosis the problem is with iron, in Wilson's disease the problem is with copper. The condition can affect children, but it typically occurs between 20 to 30 years, and there are many symptoms and signs. One particular notable sign is the Kaiser-Fleischer ring, and these are dark rings around the corneal limbus, and are commonly mentioned in exam vignettes. They are due to copper buildup in the descendant membrane. They are not seen in children, so a child with Wilson's disease will not have this sign. They can sometimes be seen with the naked eye, but frequently require slit lamp examination, so do not be looking for this sign in your friends. Normally copper is absorbed in the intestine and transported to the liver. Here it is stored and processed into ceruloplasmin. This is useful as it carries copper in the blood. However, in Wilson's disease, this process is not the way it should be, and there is a notable molecular defect. It is commonly seen in the copper transporting ATPase, and this genetic defect is located on chromosome 13. As I've said before, there are two key organs that are associated with Wilson disease damage, and these are the liver and the brain. In fact, more patients will have neurological symptoms than hepatic, 50% neurological, 40% hepatic, and 10% psychiatric, including delusions. Young adults typically present with neurological symptoms, such as tremor, dysarthria, involuntary movements, and dementia, which is of course a late effect. If copper accumulates in the basal ganglia, Parkinson's disease will occur, and this is symmetrical, whereas typically Parkinson's disease is asymmetrical. Children typically present with liver disease, whilst young adults typically have neurological symptoms. And there are a number of investigations which can be done. The serum copper will normally be low, as will the serum ceruloplasmin, but it can be normal, as can the copper. However, like ferritin, this is an acute phase reactant and can be raised in inflammatory conditions. Urinary copper typically increases. Liver biopsy should only be performed if there is uncertainty about the diagnosis, as this is a very invasive test. And what is the management? Well, it is typically managed with a drug called penicillamine. This binds to copper, and it has many side effects, including skin rashes, leukopenia, and renal damage. In terms of diet, you should take a low copper diet if you have Wilson's disease, and that excludes chocolate, peanuts, shellfish, and mushrooms. In terms of the pharmacology, we have mentioned penicillamine, and this works by binding to the copper to form a complex. This is excreted in the urine. An important contraindication of penicillamine is lupus. Thank you for listening to this video. If you liked the video, don't forget to hit like and subscribe to the channel to see more medical education videos.